we are live.
Okay, well then let's bring this meeting to order. So welcome everybody to Pellis on this Thursday, November 14th. I'd like to ask for a motion to adopt the minutes. Does anyone have any questions on them, or can I have a mover and a seconder to accept? Warden Wise and Councillor Davison, thank you. All in favor? That carries. Okay, moving on to approval of the agenda. Can I have a mover and seconder for this? Or do I need a mover and seconder?
Yes,
Thanks.
please.
Okay, perfect. Mover and seconder. Councillor Davison. Warden Wise. Excellent. All in favor. That carries. Amazing. Disclosure of pecuniary interest in the general nature thereof. I'm seeing none. Matters for consideration. So let's go on to item number 1, central intake update with Pam Kent leading this one. Pam, welcome and thank you for your report.
Thank you and good morning to the committees. This report is just to share that the province is moving forward with the centralized intake with 10 pilot sites currently, which Pellis is not one of them, but we are expected to be fully implemented at some point in 2025. So essentially what this will do is that the province will take on the role of the initial eligibility determination for Ontario Works, and then once the case is granted, it would then be forwarded to our local offices for us to do the ongoing case management of that file, so that it will reduce a little bit of administrative burden for us around the eligibility piece and let us focus on some of those higher impact pieces with the clients. The only exceptions are the emergency assistance applications, temporary care assistance, and under 18 applicants. They will remain with us at the local office. Happy to answer any questions that you may have.
Warden Wise.
Yes, thank you. So Pam, right now, when somebody is seeking assistance, how do they generally apply? Do they show up at the services building in person? Do they call? How does it happen now, and how will it change for an individual?
So yeah, and I may ask Lynn to help me with this if I get it wrong, because this is a new portfolio for me. But essentially, they can. We are encouraging them to apply through the online portal. So we're trying to do digital as much as possible. But they certainly now can call in or attend our office, and we can support them. So going forward, we wouldn't be determining their eligibility or assisting with it, but we could have like a computer in our resource area, for example, and direct them to that to help them get online to apply. But we wouldn't actually be doing the application, but we could assist them in how to make their application through the online portal.
Okay, because I don't want to generalize, but I imagine a greater proportion of such folks compared to the general population wouldn't have personal access to a computer. So you're just sort of hand-holding when it comes to the digital application at this point. So you'll continue to do that under this new regimen then?
Correct.
Yeah. Okay. Thank you.
Sure.
Oh, I don't have to raise my hand. Is there any other questions from Councillor Davison or Councillor Nyman? Just a shaking of the head if that works for you. Perfect. Then I'm going to start asking some of my questions. So does this mean that all centers will be using, like across Ontario, be using one system? So then there's ebb and flow between the different organizations, or what was Ontario's reasoning for why they wanted this system to be implemented?
I could pop in on that.
Okay, thanks.
No problem. So centralized intake actually has started about 4 years ago, and it's been slowly implemented across the province. So right now, currently, if somebody walks into our office, we can do an application with them if they want to do it that way. Moving forward, once centralized intake is fully implemented in 2025, they will not even be able to apply here. So if somebody comes into our office, doesn't have access, we have computers in our resource room that we can direct the client to. We can help them through the process if they need help. So as an example, as someone who's elderly and not good on technology, we're going to help them. And really the whole point of this when it started was to relieve administrative burden from the municipalities so that we could then spend more time working with our clients on life stabilization and referrals and intensive case management and all of that kind of stuff. So really what's changed is the province is now taking on that initial eligibility piece, and all of the applications will go through that. Then they'll get assigned down to the offices in the geographic area that they live. For the intensive case management piece. And that's right, it'll be right across the province sometime in 2025. And right now it's just 10 pilot sites. So I hope that answers your question.
Yes, but I do have a follow-up to that. I'm just curious, will this, in your experience, be used to help relieve the burden on individuals that are applying multiple times for multiple different organizations? Or will there, like, and by multiple organizations, I mean, so if they're applying for like a daycare subsidy, then also I'm not sure if then they also have to apply for homeless and then also apply for, and then would that also be able to be cross-shared with other organizations with the permission of the individual since it is already computerized? Or
So
will it just be limited to this?
it's limited to Ontario Works Assistance applicants only. So once somebody gets to the local office and we're doing, finishing up the application, getting in and having case management discussions with the client, if we find that the person is needing childcare or homelessness benefits or any of those kinds of things, our caseworkers then would be able to bring all those pieces together. But unfortunately, every program uses a different technology. So it all has to, each one kind of has to start from scratch.
Do you see any benefit with this system potentially alleviating that burden on the individual users and also then staff from not having to keep shifting between those different, like, could the centralized program be the first step of the province moving forward with that, especially if there was push, say, from political entities to.
It's really limited to Ontario Works Assistance only. So this centralized intake doesn't involve childcare. It doesn't involve any housing or any of the other programs that we deliver. It's really specific to Ontario Works. So it's not going to streamline anything for the client.
Okay, thank you.
Hmm.
Any other questions before I ask for a mover and a seconder? Okay, mover and seconder. Councillor Nunman. Warden Wise. All in favor? Okay, that carries. So now since that was just to be noted and received, we're going to move on to number 2, the child services update. Pam, you're on the floor again.
Thank you. This report, I don't really have anything to add, just wanted to highlight some of the initiatives that we undertook to support not only the workforce, but families in our community. So happy, again, to answer any questions that you may have.
Any questions? Okay, I have one. I was just curious on, is there any specific way that you recognize long-term employees or individuals that have stayed with the different childcare organizations for a long term? And is there, or any way that we celebrate individuals that are taking like the next steps to share creative ideas, ways to make things work better? Is this day also a way that we celebrate them, or is it more specifically to the work that they do on a daily basis?
Thank you for the question through you. Chair, it really is just a general celebration of the work that they do day in and day out to support families. But each individual childcare organization often does their own acknowledgement of life, like service awards, however long they've been attending. Certainly, if somebody raises that at our celebration, we do honor and support those and congratulate them, but it usually is done at each individual organization level for the service awards.
Okay, perfect. Thanks. That's helpful. Any questions before I ask for mover and seconder? Seeing none, mover and seconder for this report. Councillor Davison, Warden Wise, all in favor? That carries. Okay, we're moving on. We're just flying through this one today. Let's go on to number 3, services for unhoused people. Sorry, Pam, you have to leave the limelight for this one. And Scott Robertson, you're up.
Morning, everyone.
Morning.
This is just a report that talks about all of our services to unhoused people. I think I'll give you a couple of examples of some of the homeless or unhoused people we deal with. One thing I do want to add, I think it's on page 4 when I'm talking about Prince Edward County. I forgot to mention that Prince Edward County operates. I think I know that there's no, there won't be a warming center there this winter, but they still operate Leeward House. That's a 9-bed transitional housing facility. And I forgot to mention that. I just want to make sure, remind people that they had that. And I just want to talk about ending homelessness. I've got a few questions like, what do you mean you're ending homelessness? Homelessness is on the rise. And I agree that homelessness is on the rise. But when we take somebody who's living on the streets, the traditional route with us is to live in our transitional housing for a period of time. And that's about 1 year to 3 years before they're ready to live independently. And then when they move in independently, and then about 6 months after independent living, if all is going well, we determine that person's homelessness to be solved or homelessness to be ended. And I think I've got 30 people. I understand that's now almost 40 people that we've been successful with, which is great. The problem is, as we're solving it for those 40, as we've solved it for 40, we've had 60 or so new people come along. So we aren't solving it at the same rate as it's increasing, but we are solving it and we have successful programs. And I think one of my challenges is how do we expand that and have more people going through and more people successfully ending their homelessness.
Scott, any positive number is something, and is something to be celebrated and encouraged, and it means progress and steps forwards are being made. So congratulations. That's so exciting.
Thank you, Councilor Brandhurst. It's definitely something we celebrate in the office. And unfortunately, sometimes the celebration is a little brief because then it's like, okay, great, that person's looked after. What about these 5 kind of thing? But yeah, thank you.
If I could just, sorry, if I could just add to chair there. On page 4, you'll see that there's a chart there regarding funding. And I think it's really important to note that municipal tax money, so our local taxpayers, are paying $4 million and $28. Sorry, 4,028,000. I don't know how to say the number. Just over $4 million of money is coming directly from our local taxpayer to support housing and homelessness in Lennox and Addington and Prince Edward County. So I think it's really important for people to know. So I just really wanted to highlight it in this report as well. So that's direct money from the taxpayer. And if Prince Edward Council would like to have a report similar to this to show the breakdown, we can certainly provide that if this is something that committee would like to do because of the cost share. So really, Prince Edward County, from your local taxpayers, $1,436,700 is going to support the local homeless housing and homelessness programs that are offered. And with LNA, Lennox and Addington, it's $2,588,000. So there's a lot of money being generated from the tax levy directly from the local taxpayers to support housing and homelessness. And we're doing the best that we can do with the money that we have, being responsible to the taxpayer and providing good services. And we're showing those outcomes through those people that were unhoused and are now housed. So I just wanted to highlight that for council and for committee.
I appreciate having that breakdown. And if you'd like to give a more extensive one, I would have no problem supporting that. I always like to see where everything's going. It's always encouraging to see all the different programs. So I would appreciate that if possible. I don't know if anyone else sitting here would. Yep, we got a few others, so that would be great. I don't know if do we need a motion for that one, Beth? Or are we fine to just take it as a suggestion, correction?
We can add it to the motion if you like. Just that a report will come back to council with more detailed breakdown of the funding.
Perfect, sounds good. Let's add that on, yeah, let's add that on at the end, probably. Yeah. Councillor Nyman, I see your hand up.
Yeah. Can you hear me?
Yep.
Yeah, okay. I'm just wondering, when would that report be coming back to council? Would it be like this year or like January?
I would expect it'll probably be this year. It would depend on, so Prince Edward Council's agendas, whether or not they have room for it at the time. So I'll definitely, I'll put this together quickly and submit it to council, and it will be up to the agenda, which council meeting it's added to.
Okay, thank you.
Through the chair, just to let you know that we have it on our county council meeting for next week. And I just simply asked Lynn to break down that 4 million to the number of what Lennox and Addington County contributes out of that 4 million. So the report as it's written, with the addition that Scott will make about Leeward House, like making sure that's in there. We'll go to our county council next week. So this is an offer that we could do a similar report for you for your county council with your number broken out from that 4 million.
I would personally appreciate that. Warden Wise.
Yes, thank you. Just a question on the first line of the funding breakdown, the social housing, rent geared to income housing. We've got almost 2 million in operating. I assume that's operating annual cost, and 862,000 capital. What does that number represent? Obviously, we aren't spending that amount each year on capital. How does that number break down?
Through the chair, we actually are spending that amount of money on capital every year.
No kidding. So that's things like roofing and furnaces and all that, because we aren't building a whole lot more housing.
Exactly.
No,
It's to maintain the existing housing that we have and keep it in good and livable condition.
Okay. Thank you very much, Lynn. That's interesting.
Yeah.
Sorry, Scott.
Sorry, Chair, through you, just to add on to that. So the buildings were built in, most of them in the early to mid 70s. So some of them are on their second roofs, right, and stuff like that. And they're in really good condition. Very pleased with their condition and and that's provided by our property services, and they do a great job. Anyway, thank you.
CAO, would you like to add to that?
I would just like Scott to also comment about when a tenant moves out, sometimes because of mental health, addictions issues, behavior issues, the units are trashed. And it can be what, $30,000-$40,000 just to rehab a unit that's been trashed. So I don't know if you want to add comment.
Yeah, sure. Thank you, Brenda. And through the chair to the rest of the committee, that is true. The part of that is exacerbated by the landlord and tenant board. It's getting better, but there was a time about a year ago when we would file to have a tenant evicted, and it'd take about 18 months to get that before the landlord and tenant board. And most often the landlord and tenant board has really shifted. You can have a very, very difficult tenant we've had tenants that are threatening to harm and kill tenants, threatening to harm and kill staff, and the landlord tenant board's decision, and they haven't paid rent for a year. Landlord tenant board's decision is, well, you work with them a little longer. We don't want to create homelessness. So by the time somebody like that moves out, they've had sometimes years to create damages in the housing. And it's sad. I must add, we also get people that when they move out and we basically need to go in and maybe sweep and mop, and the place is ready to go. We don't even need to paint. So we get it on both sides. It's just way more noticeable when it's on that bad side, for sure.
Thank you for that clarification. Councillor Nyman, another question?
Yes. actually two. So, first one is the warming center in Picton. So is, are we helping them financially getting that up and going, or having that working this winter?
I can take that.
Sure.
We're not funding the Hope Center this year for a warming center. So we'll because they only had 1 to 2 people, and it was costing it was $100,000 a year, I believe, off the top of my head, to support those 2 people, and it'd be much more economical to support them in another way. So we're using Salvation Army as the contact, that if someone is homeless, needs a place to stay, they would contact the Salvation Army, and they would make arrangements for them. And then on the next business day, they would connect with our office, and our staff would then work with them to try and get them housed or find temporary accommodation.
Oh, okay. Can I just have a follow-up?
Yep.
So just on that, this wasn't my second question, but your answer raised another question, was in the past year, we got Salvation Army, and then we have one of the motels that accommodate. So how many people have we accommodated or helped with the 3 places? So you got the Hope Center, you got Salvation Army, and you got the motel. I guess I'm just wondering, can we not centralize it, or would that not be a good way to go?
So I think it really is centralized. So the Hope Center is not running as a warming center this year, to my knowledge.
Okay.
So if somebody presented to the Hope Center, they would probably connect with Salvation Army or with our office to help that person. Or if they
Okay.
approach Salvation Army, the same thing would happen.
Okay, so the Salvation Army is the warming center this year.
They're
I
the
just heard Scott say there was a warming center, so I'm just wondering where it was or where it is.
No, there isn't a warming center in Prince Edward County.
There isn't.
I don't think you said that, Scott. I think he was mentioning about Leeward House, which is the transitional housing that Prince Edward County is running. And that really has assisted with the numbers of homeless. So it's putting people who are unhoused, a lot of them are living there. If somebody then now turns up that they've come back to the area, released from incarceration, whatever it is, their contact really is our office during business hours, and after hours, it would be Salvation Army to assist them.
Okay, no, thanks. So then, can I ask my second question?
Yep.
So Scott, the 40 people that have been a success, how many of those have come out of the Leeward House?
I don't think yet. I think Leeward House I was at a meeting last month, and they had their first person that had moved out into permanent housing. They kind of run their own stats, and they report to it. We provide funding to Prince Edward County to operate Leeward House. So they'll provide us with an annual report towards the end of this year. We'll get an annual report from them, and then we'll know their stats. They often share their information with us. Like, it's not that they don't, but it's just not a stat that we have, that I have on hand.
Okay, thanks.
But most of the people that are living at Leeward House are involved with our office. They usually are connected with a caseworker, for sure.
Okay, so do we have any stats on how many of those 40 success stories are in Prince Edward County?
No, we don't, but I can get that for the next
Okay.
meeting.
Okay, thank you.
Sure, yeah, that'd be interesting.
Okay, I would also, just tacking on to Councillor Nyman's, if you could divide it in Lennox and Addington between the different areas also, I'd be curious with that information, like if it's just Napanee or if it's the other smaller communities, and just seeing how the different success rate spans out.
Yeah, sure, I can divide it on the 4 member municipalities in Lennox and Addington and Prince Edward County.
Okay, perfect, thank you. Any questions before I move on to mine? Seeing none, okay. I am curious on specifically with the individuals, sorry, I'm in the beginning of your opening, when you're talking about the by name list and people who are couch surfing or have a room, but they are technically homeless. I believe this is for anyone following along, this is on page 1 or 2, or staying at a friend's house. Are they on the buy list even if they have a room past the 2-week mark, or are they not considered homeless at that point?
Oh, yeah.
I'm curious.
That's okay. It's just it's a listening as opposed to a talk.
Yes, what it is, as long as a person remains unhoused, they can, and they want to be on the by name list, they would be on the by name list. So sometimes a person be homeless, like living on the street, and then they're at a friend's couch for a week, and then they're in their car or whatever, they would continue to be on the by name list.
Okay. And I'm just curious on specifically why the 2-week minimum to be on the by name list. Is that just a successful result you've seen? Because you did acknowledge in the report that there was like you're not saying you have to be 2 weeks homeless to be considered homeless. Staff will work in between. I'm just curious why that number.
Oh, and I've got a great answer, because the province gave us rules around what qualifies for somebody to be on the by name list. And one of the rules was the person had to be homeless for 2 weeks. And the reason that they put that in is, I think I give an example of a person who, on a Friday, there's a relationship breakdown. And by, next Tuesday, they've got housing because they were able to do that. And they came to our office, maybe got first month's rent or last month's rent or whatever, and we helped them out. So that sort of temporary homelessness, the province didn't want to track. They're sort of thinking after 2 weeks, okay, it's getting serious. And there's data to suggest that if a person's homeless for 2 weeks or longer, then that can really become extended. Whereas if they're homeless for less than 2 weeks, even if they become homeless again, they're most likely going to be able to solve their homelessness, at least temporarily, within 2 weeks. I would note too that there's a spot in here where I talk about acquired brain injuries and basically just the dominance of acquired brain injuries in the unhoused client group. 50% before of people who are unhoused have an acquired brain injury before they're homeless. And then that just gets worse as people are homeless, just falls, opioid use when they have to use naloxone. There's prolonged hypoxia, it's called, but just when the person's brain is without oxygen, there's damage to the brain. And if that happens multiple times and multiple times and longer, then the person's brain injury increases, and just stuff like, it's like the day of the week, the time of day. Remember, you've got that big doctor's appointment next Tuesday afternoon. It's just really difficult. It makes it really difficult for them to manage, even with a support person, but definitely almost impossible without a support person. And unfortunately, due to the injury, sometimes people think they're doing just fine and refuse to help. And that's a symptom of the brain injury and maybe of the addiction issue, but it just makes it more and more difficult to assist people that have that.
Sorry, just off of that note, I was under the impression that if individuals did not have a home address, then OHIP didn't cover them. Is this true or false, or?
I don't think so. I don't think that's accurate, but I'll look to Lynn to see. If a person doesn't have an address, they can't get a shelter allowance or rent money from us or from disability. You have to have an address, and that's not our decision. That's the province's decision. I would argue that living in your car is probably more expensive than living in an apartment, given that you're having meals out, you have gas, you have to have a car and insurance and all that stuff. But that's not my call, but that's the way it is with that. But I think, Lynn, do you want to comment But okay.
I think, are you referring to like the drug card for somebody who's on Ontario Works or ODSP for coverage?
I'm just curious on how I heard this number and I just wanted it clarified here that, or not number, that individuals that are homeless have to pay for their own OHIP coverage. So like if they went to the doctor or
Oh.
hospital, they would be charged.
No, that would not be, that's not true. So every person
Okay.
in Ontario is eligible for a health card. So as long as they have a valid health card, they would be able to receive medical assistance from a hospital or a walk-in clinic and all those kinds of things. If they need prescriptions, if the person is on Ontario Works or ODSP, even if they only receive the basic needs allowance, which is the food portion, they would still receive a drug card. So then they would be able to, they have assistance through for prescriptions through that drug card. If they're not in receipt of Ontario Works or ODSP, so say it's somebody who's on CPP disability and doesn't qualify for ODSP, they unfortunately do not have drug coverage because there's no drug coverage with the Canada Pension Program. So it really depends on the person's income. But everybody who's a resident of Ontario should be able to have a health card. And I know that hospitals will work with people if they have an expired health card, they would still receive treatment, get that new card updated, and then they wouldn't be billed.
Okay, that sounds more accurate. So thank you for that clarification.
And just further to that, if I could, some of the efforts we take here at Pellis are to ensure that people don't have to go to the hospital because unhoused people can consume a lot of resources at a hospital. So we partnered with our community paramedics so that people who are unhoused are getting treated. And there's a lot of, cuts, scrapes, bangs, bruises that the community paramedics deal with so that people don't have to go to the hospital. So we're trying to divert people from those heavier resource laden places so that our emergency rooms are ready for people who are just suffering from minor cuts and bruises. So,
And that's both because we don't share paramedics. So is that both sets of paramedics do that?
no, it's just in Lennox and Addington. We were just talking about this last week where we've got this program up and going, and it's time to partner with Hastings Prince Edward paramedics and see if we can get a similar program going there.
Well, if you need a motion from council, we have on Prince Edward's side, let me know if you need like Councillor Nyman's help and my help, and I'm sure we can really aid in that process.
I have a few contacts there. I can reach out and we can see where it goes and take it from there. I'm sure they probably know our community paramedics here, so maybe we can get everybody together, talk about how it's going and what we can do in Prince Edward County.
Yeah, that's very exciting. Thank you for that. Do I have any more questions? Yeah, Warden Wise.
Yes, thank you, Chair. That figure of 50% of people having some kind of brain injury when they first become homeless is astonishing. It comes from Brain Injury Canada. I don't know, how rigorous the research was on that, Scott, or I know you wouldn't have put it in there if you didn't think it had a lot of validity. I just wonder if you could expand on that a little bit. If that's true, if the general public realized that half the people who are unhoused have a brain injury, there'd be a lot less comments like Premier Ford made recently that these people should get off their butt and get to work, which I thought was just pandering to his base, if I can get political for a moment. But could you expand on that brain injury statistic?
Sure, Chair, through you to Warden Wise. I actually heard it at a meeting about 2 months ago, and I thought, can this be accurate? So I researched it, and since I've written the report, I was actually at a housing and homelessness conference, and I was checking it out there with some of the people who I know who are leaders in the field, and they were like, well, yeah, and they pointed me to a bunch more evidence. And you're right, I wouldn't have put it in there if I wasn't comfortable with its validity, but it certainly makes a lot more sense in explaining why some of the people we deal with just have so many repeated difficulties. And I've said this before, and this is just for me as a person who has been involved in housing and homelessness, not me as some sort of person who can do assessments, but I would think that some of the people that we're housing who are unhoused and some of the people that we can't house because they're unhoused would be eligible to be in like a community living group home situation or a pathways to independence group home situation. We just aren't able to get them there. At just some of the level of cognitive impairment is so severe. It's troubling. But yeah, I will continue to do more research on this because it's definitely connects a lot of the pieces of the puzzle with, you know, what are some of the major impediments we have? Well, if 50% of the people have an acquired brain injury, that makes them so much more difficult to work with. And even just scheduling appointments. The person has difficulty telling time and following a calendar. Well, how will they make it here next Tuesday for a big meeting? It's difficult.
This is something that should be more widely known. Thank you.
Yeah, yes, I always try to put a bit of education in my reports, and I was trying to share the knowledge that I'd recently discovered on that. But yes, I did research it. Throughout some places are as high as 60 or 70%. I thought the Brain Injury Canada had the most accurate and paired well with some of the other state reports I read out of the States and in Canada.
Well, thank you for that. And so we will put, I guess, my amendment on the floor now, Beth, but I don't know if I can make it as chair.
Do you want me to read what I've drafted?
Sure.
As a revised motion? Okay, so that the November 1st, 2024 staff report reads services for unhoused people be noted and received. And further, that staff provide a report to Prince Edward County Council at the next meeting, further outlining the breakdown of 2024 municipal funding.
Yep, that sounds good. Are we, so
I can make that if you can't. I can make that if you can't.
Okay.
I'll second it.
thank you. That sounds great. So then all those in favor? That carries. Okay. Moving on to our last section of measurables. Oh, yes, I am unmuted just in case. Performance metrics. Liam, take it away.
Thank you, Chair. Good morning, everyone. This report is just to provide some updates on the performance metrics at Pellis. So in our Ontario Works portfolio, we saw a slight decrease in applications received from the months of August to September, decreasing from 73 to 66. The current caseload as it stands in September was at 943 clients, decreasing from 968 in the month of August. Pellis saw an increase in percentage of terminations exiting to employment from approximately 13% in August to approximately 26% in September. And those statistics match the provincial trends for the same time period as well. Transitioning over to children's services, a total of 5 applications for childcare fee subsidy was received in the month of October, with 4 and 7 applications received in August and September, respectively. A total of 136 children are currently registered for childcare fee subsidy, representing a total of 83 households served across both Prince Edward and Lennox and Addington, and with the main reason for the access being working, representing approximately 77% of the caseload's reason for access and care. So finally, in housing, there are currently 85 active individuals on our by name list. 17 households were placed in the rent geared to income housing for the months of August to October. A slight increase was realized from August to October in occupied rent supplement units, increasing from 106 to 110, and the current housing waitlist has grown to 581 in October from September's statistics of 558. So I'd be happy to answer any questions the committee may have at this time.
Any questions from committee? I'm seeing none. So can I have a mover and a seconder? Councillor Davison, Councillor Nyman. Great. All those in favor? That carries. Eh, Sorry. Okay, let's adjourn this meeting now. We need a motion, move to adjourn?
Yes, please.
Councillor Davison? Warden Wise, thank you. This meeting now adjourned at 10:49 a.m. Thank you all.
Thank you.